Hello, I'm Dr. Anthony Gonzalez. I'm a general, robotic, and bariatric surgeon down here in South Florida. I'm born and raised in Miami, went to college at the University of Miami, and went to medical school at the University of Miami School of Medicine. I've been in private practice here in South Florida at Baptist Health since the late 1990s. I am the chief of surgery at Baptist Hospital of Miami. I run the bariatric surgical program as the medical director of the bariatric surgical program for Baptist Health. And I'm the founding program director of the Minimally Invasive and Bariatric Surgery Fellowship. That is a fellowship where surgeons spend a year with me after residency to learn advanced robotic and bariatric surgery. Today, my practice is 70% general surgery. General surgery involves conditions like hernia, gallbladder, reflux, and even colon surgery. And 30% of my practice is dedicated to bariatric surgery or weight loss surgery. All of these operations are done through minimally invasive robotic approaches as my experience as a robotic surgeon. Now, let's discuss a few common conditions that I deal with on a daily basis. Thank you.
In this video, we're going to talk about pilonidal cyst. Pilonidal cysts are very common. They were first discovered in World War II when 80,000 soldiers were inflicted by a pilonidal cyst due to the hair and sitting in jeeps. It affects young, healthy adults, but the good news, it's very treatable. The key point of a pilonidal cyst is that it occurs in the upper buttock crease. It's caused by hair penetration, inflammation, and it leads to a cyst formation, sinus tract formation, and even infection and an abscess. The symptoms that you can have as a patient are pain, pressure, swelling, even drainage on your underwear, or even an abscess or a very tender lump that would cause you to go to the emergency room. There is no medication to treat a pilonidal cyst, with the exception of antibiotics when there's an infection. The underlying pilonidal cyst has to be treated with surgery. So when do you need surgery for a pilonidal cyst? You need surgery when there are recurrent infections, when there's drainage and soiling of your underwear, when there's a chronic sinus, or when there's pain affecting your daily life. The drainage of the abscess treats the infection, but the surgery treats the underlying disease. A pilonidal cyst is treated by pilonidal cystectomy. That's the operation that removes the diseased tissue, removes the nest of hair, and removes all the sinus tracts. This prevents the recurrence of the pilonidal cyst as well as prevents any ongoing infection. The patient is placed under general anesthesia. Obviously, the patient's placed face down. We remove all the diseased tissue, the cyst, the sinus, the nest of hair, and we close the wound completely, leaving a drain to drain the space that was removed. The patient is discharged home immediately after surgery with antibiotic therapy and with their drain. I ask the patient to not sit on the wound for 1 week, 7 days, not sit on the wound and care for the drain. The patient comes to the office 1 week later to remove the drain and 2 weeks later to remove the sutures. You're basically completely recovered from the pilonidal cystectomy within a month. Now, long term, it's very important that the hair is constantly removed so that you don't get another pilonidal cyst. So lifestyle as well as the surgical treatment is what's going to prevent the recurrence long term. Remember, surgery removes the disease, but prevention, hair removal, prevents the recurrence of the pilonidal cyst. Pilonidal disease can be frustrating, but it's very treatable. With proper surgery and good postoperative care, patients do very well.